Knock, knock. Good morning. How are you doing today? I'm doing great. Thank you for asking. My name is Natalie. I'm a nursing student from TW, and I'm going to be administering your insulin subcutaneously this morning, okay? Okay, great. And can you please confirm your name and date of birth before we begin? Okay, great, Mrs. Winthrop. And I see that you don't have any allergies. Is that correct? Okay, great. I'm just going to verify the order with you. The MD did order that I administer your regular insulin and NPH insulin, okay? Okay. Okay, I'm just going to match this to the MAR before we begin. Oh, before I do so, let me provide privacy, okay? Provide privacy. And I also need to confirm with the faculty your morning glucose levels, okay? And what was that?
155.
Okay, thank you. So your morning glucose level was 155. So I'm going to use the sliding scale insulin. And because it's 155, I'm going to do 4 units of regular insulin plus the MD's order of 30 units of insulin, okay? Okay, great. So now I'm just going to get the supplies ready and place the order. Have my syringe and my alcohol pads. And I'm just going to match the NPH to make sure it's the right medication. And the regular insulin matches. Okay, great. So now I'm just going to perform hand hygiene again. And I'm clean the tops of the vials before I actually insert my syringe. So I'm just going to get the alcohol wipe and clean the tops. Same thing here, making sure the wipe is still wet. Okay. I'm going to open my syringe. Okay, and going to, of course, uncap it. And I'm first going to begin by inserting 30 units of air into the NPH vial. And I'm just going to keep it at eye level and make sure that the top of the plunger is at 30 units. So I'm going to put 30 units of air into the NPH. I'm going to keep it down. Okay, and now I'm going to do 4 units of air, so right there, for the regular insulin. Okay, but this time I'm going to turn upside down and carefully aspirate 4 units of regular insulin. I'm just going to take it out. And now I'm going to insert my syringe into the NPH. I'm going to turn it upside down, and I'm now going to pull for 30. Making sure I don't get any air bubbles. And my total should be 34 units. Okay, so I have 34 units. And now I'm going to do the scooping action to put on the cap. I'm just going to cap it before I actually insert it. So now I'm going to perform my 6 rites before I actually administer my insulin. So this is Mrs. Winthrop, Mrs. Gwen Winthrop, and she's born February 10th, 1942. She has no known allergies, and this is the correct medication. She is getting her morning insulin of regular and NPH, 30 units of NPH and 4 units of regular. So it is the correct dose and it is the correct route subcutaneously, and it is the right time to do so in the morning. And I will document this when I am done. And Mrs. Winthrop, you do have the right to reject this medication. Do you reject today? No? Okay, continue. Okay. So now I'm just going to place the order right here. And I'm now going to perform hand hygiene again and don on a clean pair of gloves. Are you doing okay, Mrs. Winthrop? You're used to this? Okay. Okay. And now I'm just going to remove your blanket. And just gonna roll that down. And I'm going to just expose the area that is needing to be exposed, okay? So I'm just going to show off her abdomen, since that is the area where we will be injecting your insulin in today. And I'm just going to get an alcohol wipe. I'm going to open it, and I'm going to clean the area before I inject. I'm going to go in a circular motion going in to out. And I'm just going to leave it there, that way I know that that's the right area. And I'm going to let it air dry, not fan it. So, okay, so now I'm going to open my syringe and I'm going to inject into her abdomen. Okay, Mrs. Winthrop, I'm going to insert the injection now, okay? Are you ready? Take a big deep breath, okay? Great job, awesome. I'm gonna do the same thing, scoop it, and discard in the biohazard trash. Okay, and I'm just going to remove my gloves and perform hand hygiene. And are you doing okay? I'm just going to... Okay, Mrs. Winthrop, are you comfortable? Are you in a comfortable position? Do you need to use the restroom? No? Okay, and do you have all of your personal belongings? Okay. Here's your call out in case you need anything or have any questions. And do you have any questions for me before I leave? No? Okay, well thank you so much for your time, Mrs. Winthrop. Have a great day. Bye-bye. Hi, I'm going to be demonstrating the sites for intramuscular injections and the Z-track method. And first I'm going to demonstrate the deltoid site. So I'm just gonna remove her gown. And first I would go to the upper part of the arm and go to the lateral side and try find the acromion process, which would be around here and on the end part of the acromion process, and it would be somewhere right here. And then I would go 2 to 3 finger breaths down, so 1, 2, and I'm gonna have like a V triangle shape right here, and I would inject the injection in the middle of that at a 90-degree angle. And for my Z-track method, I'm gonna demonstrate it on the deltoid site. I would find my site, so 2 to 3 finger breaths, 1, 2. So I'm gonna keep it like that, the triangle. And I'm going to use my left hand to keep the site taut, keep the skin taut. And I'm going to use my dominant hand to inject the injection. And I'm gonna have it like a dart and go very fast and direct. And I would put it in at the site and keep it in for 10 seconds. I will inject it first and keep it in for 10 seconds while keeping the skin taut. And once I inject it, I'm going to take it out and release. Next, I'm going to demonstrate the ventrogluteal site, and I'm just going to lift my patient's gown. And first, since this is her right hip, I'll be using my left hand to or my left palm, to put it on her greater trochanter. So about, it would be around right here, but she's a little dissembled. So I would put it around here, and then I'm going to move my index finger to the anterior superior iliac spine, and then I'm going to move my middle finger and the rest of my fingers and feel for the iliac crest, and then I would inject in between that at a 90-degree angle as well. And that's it. Thank you.